Hi, everybody. I'm Cecilia Howard, and welcome to my YouTube channel, Less Stress with Mindfulness. As promised in my previous video about anxiety, face mask wearing, and mindfulness, I had told you that I was going to record a practice-only session so that you have the opportunity to simply come back to this recording as many times as you like to practice both with wearing a mask and both without wearing a mask. So practicing having that mask on and having the mask not on. We're actually going to start without the mask first, and then we'll move into using the mask. So it might be helpful if you have the mask handy nearby in a place that you can easily grab it. The mask that I'm going to be using today is one of these disposable medical masks, and you certainly can wear any mask that feels comfortable to you. If you remember my previous recording in regard to talking about the types of masks that people wear, my biggest, for me, my biggest revelation was finding a mask that really fit my face well. And that helped me so much with my comfort level. There are so many different designs. There's so many different styles of masks. So find that mask that really feels comfortable as it can on your face. We know that there's discomfort. So if you want to learn more about my take on things when it comes to wearing a face mask and how we can reduce anxiety, please view the previous video, the recording, which is on anxiety, face masks, and mindfulness. This will be a practice-only session that you can come to again and again. So without any further ado, we're going to dive right into practice. So I want to have everybody come into a comfortable seated posture, feet flat on the floor. If you can take your shoes off, that's great, so that you can actually feel the carpet or the softness of the floor beneath your feet. If you are having trouble reaching the floor, I suggest that you get a rolled up towel or maybe some sort of footstool and place it under your feet. You can have your shoes on, that's fine, but I know that it definitely helps you to feel this sense of rootedness and groundedness when our feet are actually making contact with the floor. Your spine is erect, as straight as you can have it, but you don't want to have your shoulders be stiff and up towards your ears. So you want to sit in a nice upright posture with sloped, soft shoulders. So not squaring things off, just a nice gentle slope to the shoulders. Face or head in a neutral position, so we're not looking up at the ceiling, we're not looking down at the floor. It's just a neutral position, maybe the chin slightly pointed down. Eyes are softly closed. Hands are face up or face down on your thighs, or they could be resting on the arms of the chair. Softening your abdominal muscles, allowing the air to just enter and exit of its own accord in and out of the body, but allowing more space in that abdomen for air to enter and exit. And breathe. So begin by starting to just slowly become aware of your body, the weightedness of your body in the chair, the weight of your feet resting against the floor, the weight of your hands or arms resting on your thighs or on the arms of your chair. The weight of your back pressing into the seat the weight of your head on your shoulders, the weight of your entire body just sitting here, starting this guided meditation. Letting thoughts come and go just like clouds in the sky, not grabbing on to any one thought, but just allowing them to simply drift by. Pulling the tongue away from the roof of your mouth so that you feel this residual softening in your jaw. So let that tongue either float softly inside your mouth, or if you need an anchor point for it, placing the tip of your tongue where the back of your teeth meet your gum line. And gently press the tongue, the tip of the tongue there, if you need an anchor for the tongue. Otherwise, let it just soften and drop in your mouth. And then I want you to just bring your attention to your bright breathing, to your breath, to the fact that you're breathing. Just notice the inhalations and exhalations as you breathe in and out in your body's own natural rhythm. Just letting the breath flow in and out of your body. And then I'd like you to bring your attention to your abdominal area. And I want you to imagine that you have a balloon in this abdominal area. And every time you inhale, the balloon expands. And every time you exhale, the balloon contracts. So when you inhale, there should be a gentle rise to the abdominal area. And as you exhale, notice the gentle decrease as the abdominal area lets go of this air. So bringing your attention to this balloon and allowing yourself to just inhale and exhale, envisioning this balloon. If you like, you can even take the palms of your hands and gently, ever so gently, place them right at the abdomen so that when you inhale and exhale, there's a bit of tactile sensation that you are literally feeling that expansion and contraction. And I want you to follow your own breath, your own breathing pattern. I'm not going to count it out for you, but I want you to do this on your own. So I want everybody to honor their breath, their breathing rate, exactly as it is for right now. So just inhale and exhale and follow your breath from this abdominal area as the balloon inflates and deflates. I want to do that in silence for just a few moments. And if you notice that you're starting to slump forward in your chair, or maybe your shoulders have tightened up, or you've shifted a bit, just straighten the spine again. Soften the jaw, release the tongue. Breathe and just allow yourself to fill that balloon belly with air on the in-breath, and to release the air from that balloon belly as you exhale. Again, doing this in your body's own natural rhythm. Let those thoughts just come and go. If you lose your way or get distracted by a sound or a thought, not a big deal. Just start over. Just come right back to following your breath, following that sensation of inhalation and exhalation. So let's just do this for just a bit longer in silence. Just following and feeling into the sensation of that balloon breath. And then taking this opportunity to just do a few more inhalations and exhalations, feeling that balloon expand and contract, breathing in and out, and honoring your body's own natural rhythm. And then very gently, I want you to just open your eyes a little bit. I want you to take your mask in your hands. I want you to do whatever you need to do to position that mask on your face. You can move slowly and mindfully, placing it on your face in a comfortable, appropriate position, wearing your glasses. If you typically wear glasses when you wear a face mask in public, I suggest that you place your glasses back on your face. And whenever you're ready, you take your time. You position that and breathe. And we'll give everybody time to catch up, to position those masks. All we're doing is sitting back and breathing through our nostrils, closing our mouth gently, repositioning our body again, closing eyes gently, hands face up or face down on your lap or on the arms of the chair, feet gently pressing against the floor, spine erect, chin slightly tilted, and breathe. And then what I'd like you to do is Draw your attention down to your abdominal area and start with those same gentle belly breath, balloon breathing. Again, you can place your hands ever so gently on your abdominal area, or you can keep your hands where you have them now. And just envision that balloon again inside the abdomen. And as you gently inhale, the balloon expands. And as you exhale, the balloon contracts. And I want you to do this for a few rounds, just as we did at the beginning without the mask on. Now we're going to do this with the mask on. So just do a few rounds of this on your own in silence. Gentle breathing. Relax the shoulders. Soften the abdomen. Feel that balloon expand and contract. And again, let all the storylines in our head just come and go like clouds in the sky. And this time, I'd like you, when you're ready on your next inhalation or the next, whenever you're ready to join in, I want you to inhale and silently count to the number 4. And then when you exhale, I want you to try to elongate the exhalation to 6, 7, or 8 seconds. So inhaling gently to the count of 4, exhaling to the count of 6, 7, or 8. And it's your choice whether you want to exhale through your nose or through your mouth. Totally up to you. Inhaling to the count of 4, exhaling to the count of 6, 7, or 8 silently. And I'd like you to do this now in silence for a period of time. And begin anytime you want. On your next inhalation, same thing. I want you to inhale silently to the count of 4. And then I want you to pause for just a second or two before you exhale. And then after you finish exhaling, I want you to pause a second or two before your next round of inhalation. So in other words, after each inhalation and after each exhalation, just a gentle pause of a second or two before you inhale and then before you exhale. So again, inhaling to the count of 4, you would pause and then exhale to the count of 6, 7, or 8, and then pause. And do a few rounds of this in silence now. Remember inhaling gently to the count of 4, pause for a moment or two, and then exhale, elongating the out breath to 6, 7, or 8 seconds, and pausing for a moment or two before you start the round again. Your choice whether you want to exhale through the nose or through your mouth. And then you can stop that counting breath. And I want you to return to that very gentle inhalation and exhalation, just honoring your breath exactly as it is. Just breathe in and out in your body's own natural rhythm until we hear the chime to end our practice session. So just breathe in and out. Letting thoughts come and go. Remembering that initially this may feel a little odd or disconcerting, and that's perfectly normal. But the more you practice wearing the mask, gently breathing, drawing the attention deeper into the body, to the belly, the more relaxed, calm, and at peace your mind should feel. Try practicing this at least once a day. Several times a day would be even better. But the important thing is to practice, to feel the discomfort and practice anyway. Just bring that discomfort right along with you as you inhale and exhale. So taking this final moment to just deeply inhale, maybe one more time, and exhale. Don't ever feel in a rush to open your eyes when a meditation period has ended. I particularly like to sit back and just take things in, to slowly open my eyes when I'm ready, to slowly take off your mask, take it away from it's caught onto your eyeglasses, to come back into that seated posture, maybe even gently close your eyes again, and to breathe, to just breathe now without the mask. Maybe inhaling through the nose and exhaling through the mouth for a few rounds, counting it out or not counting it. Just honoring your body's own natural rhythm. You're breathing in through the nose, exhaling through the mouth. And when you're ready, and only when you're ready, And some of you may want to keep on practicing this even after this video is ended. So please don't feel like you have to open your eyes now. But if you're ready, open your eyes. Maybe do some little gentle stretches or movement with your neck or your arms, just to loosen things up. Bring a little movement into your feet and your toes. And when you're ready, you go about and return to your day. So I want to thank everybody. Please remember to subscribe to my channel, Less Stress with Mindfulness. Have a beautiful day.